So nonverbal communication that you're going to notice as your loved one progresses through Parkinson's, the majority of the communication, typically 70% is nonverbal. So what is that made up of? It's made up of gestures. It's made up of your tone of voice. It's made up of your facial expressions. And you want to make sure those actually match what you're saying because that's what they're going to be able to cue into. So when you communicate, as much as you can, use proper nonverbal communication. And you want to teach this to everybody. It's not just you as the caregiver, it's other family members. It's possible employees that the person used to work with. It's having the FedEx person come to the door, the mailman. When you go out to the grocery store, it's okay to tell people what is happening and give them a heads up. It's going to help your loved one feel successful, feel good about themselves, and have more positive experiences throughout the day. So how does Parkinson's affect nonverbal communication? Again, pauses in speech seem to be an invitation for somebody else to talk. So allow them time to process their thoughts and to say what they need to say. If you're going to jump in and interrupt them, they're often going to feel frustrated and it's going to shut them down and they're going to stop sharing and they're going to stop trying to get out what they're thinking. And by doing that, you're certainly not increasing their quality of life. They have a hard time with facial expressions. Again, they often have a mask-like face. So you may be saying something where you would expect them to feel sad. This person passed away, or you may be crying, you had a really rough day, and they can't show you that they're supporting you. They can't show you the societal feelings that are expected, but know that that is underneath, that your partner is still there. Those are a few of the difficulties that can occur with nonverbal communication. Again, facial expressions we talked about. Eye contact is so important. That's another part of nonverbal communication. So if they have difficulty with facial expressions, if they have difficulty with pauses, eye contact is so important. So look into the person's eyes, but not from above them. You never want to lean over them and make eye contact. Imagine what that feels like for the person that's sitting down underneath you. It feels like they're not as important. It feels like it could be intimidating when you're really looking down at somebody. So instead, bend down, sit in a chair, and get at their eye level. Make eye contact when you talk to them. Gestures and touch. If they're having a hard time understanding what you're saying, use as many gestures as you can. Point, use your hands, let them know what you're talking about. Tone of voice should always match what you're saying. It doesn't do any good if you're saying something that sounds kind or loving, but you sound angry and frustrated. They will pick up on that in a second. So always match your tone to what you're saying. And lastly, body language. Be very careful about crossing your arms, about standing right in front of somebody or leaning over, about putting your hands on your hip or cocking your hip like this. You never want to give the impression that you're rushed, that you're disgusted, that you're in a hurry, that you're frustrated. Really watch yourself. It's not just watching your loved one who you're caring for, it's watching you to make sure that you're doing a good job communicating. So we just talked a little bit about how your attitude can actually be communicated non-verbally. And again, make sure that your actions line up with your tone of voice. If you go to help your loved one get ready in the morning, and you're trying to be kind and you're offering options and you want them to get dressed, but you're really in a hurry and you're just booking through it and you're not using the right tone of voice and you're sort of shoving their clothes on, what are they going to feel? They're going to feel that they're a burden, that you don't have enough time for them, that you don't really want to be there. They pick up on these things so easily. So again, watch your attitude, keep it in check, make sure that your nonverbal communication skills match your verbal communication skills.